Hey everybody, this is Preston Pascal, and this is my presentation on the PICO question and blood flow restriction and ACL rehabilitation. Our objectives for this presentation are: does blood flow restriction training help boost a faster recovery for patients who have undergone ACL reconstruction? So we're looking at if the benefits of blood flow restriction benefit a patient before and after ACL reconstruction. So does it help them improve their functional ability and also their mobility in general? How to determine if blood flow restriction is safe and appropriate for patients, understand how blood flow plays a role in functionality and mobility, and then how can this be applied in the clinical setting? First off, what is blood flow restriction training? I have a definition here and also a picture. Blood flow restriction training is a technique that involves a partially restricted blood flow to the working muscles during low load resistance exercises to target the musculoskeletal and cardiovascular response to training. So obviously in this example, I tried to pick the best picture that would resemble an ACL reconstruction. As you can see, there's a cuff there that works essentially the same as a blood pressure cuff. It would be pumped up to a certain number, which is based on a person's body weight and where they are at in recovery. Does blood flow restriction result in a faster recovery time? First, we see here on the right-hand side is a diagram of people that have benefited from blood flow restriction control and then people who have not. So the yellow or the orange line is people who didn't use blood flow restriction recovery, and the blue line is. So you can see kind of to start out, we see that the blue line is increasing, whereas the orange line is kind of neutral, almost decreasing at the beginning, and then they both kind of plummet, which would be 2 weeks post-op, and then we see that using blood flow restriction increases all the way up to 6 weeks. It's shooting all the way up to a score around 60, and then we see that without using blood flow restriction, that score is kind of down around the 48 to 50 range. So blood flow restriction therapy before and after ACL reconstruction results in improved patient outcome scores. This IKDC score is basically a functional score. It is a paper that patients will fill out before and after physical therapy, usually during progress notes or checkups that they have with their therapist. Patients using blood flow restriction have shown faster improvements in walking, stair climbing, and return to sport milestones compared to those without. Some protocols report faster return to play timelines and higher scores on functional performance tests, which is what I mentioned before. So with the blood flow restriction training, we see that we are receiving higher scores throughout the 2 to 6 week period and pre-op. Without it, we are seeing that those scores are not near as high. Is blood flow restriction effective? So here we have a picture of a guy doing what looks like a unloaded squat with the blood flow cuff around his quad, which is going to be working in the lower extremity. So how is this effective? We have low mechanical load, which minimizes the stress of the healing ACL graft, joint capsule, and surrounding tissues, especially important during the first 6 to 12 weeks post-op, which we saw in the diagram before. This one here, we can see from 2 to 6 weeks that we are increasing drastically compared to not using blood flow restriction, right? We also have, backed by research and protocols, according to Jeremy Loenek, the available evidence suggests that the application of blood flow restriction does not appear to induce muscle damage response when using single exercise protocols up to 5 sets. So with that said, in certain limitations and in certain protocols, this is very effective. If it is overused or underused, it may not be near as effective, right? Using single set protocols up to 5 sets to volitational failure. So we kind of see this window to where if we are at this right number, which is 5 sets to almost failure, we have very good results. Too much or too little could vary. Another benefit of this is you can begin in the early stages of rehab, 2 to 3 weeks post-op. We saw that window of 2 to 6 weeks is kind of the best window of beneficial use. During early mobility and muscle activation phases, we see that traditional strength training isn't yet appropriate. So doing your, like in this picture here, unloaded squats without blood flow restriction isn't as beneficial, according to the research, as doing them without. So can help prevent atrophy without compromising healing. What is the role in functionality? So we kind of have a two-part thing here, functionality and mobility. Blood flow restriction enhances functional strength for movement tasks, and it results in better functional scores, like, as mentioned before. Some examples of this are the timed up and go test, single leg hop test, and sit to stand test. Some of these are done kind of before the post-op period and then after the post-op period. But here we have a diagram of the single leg hop test. We can see that the total distance on single leg and then triple leg and the crossover in time. So kind of see that overall with blood flow restriction that we get more results from what we are doing, right? So how does it play into mobility? After procedures like an ACL reconstruction, blood flow restriction helps patients regain safe, load-free strength early on. So we're benefiting the strength early on in the early weeks of post-op surgery. This is going to promote longer and more efficient movements like ambulating, ascending and descending stairs, balance, and coordination. When it comes to ambulating, we see that it supports gait mechanics and reduces fall risk. Ascending and descending stairs, we see that it builds strength and endurance early on with heavy load, like we mentioned before. And then overall, with both of those, we're going to see an improvement in balance and coordination. This is just going to essentially improve blood flow to the area, and then with improved blood flow, we see that more oxygen is being pushed to that area too, which is going to help heal that graft and reduce inflammation and edema overall. So how can this be applied to the clinical setting? As mentioned before, blood flow restriction training can result in increased muscle strength, increased hypertrophy, and increased functional independence when performing at a lower load. All of these things are topics that we are looking for in a post-ACL reconstruction, and they're all important things. It's not that blood flow restriction is the only way to go about treating a post-op ACL patient. We can do this without it, but with the research and the charts that I've shown, I believe that it is a very positive step when it comes to ACL rehabilitation. And I think that it can be used later on as well. I think it's something that could maybe require a little bit more research, but with our case, we see that the patient's strength is adequate for the situation, and I don't see why blood flow restriction training couldn't help this patient. Here are my references. I have the images and the articles I use for this. Thank you guys very much.